Hi, I'm Elizabeth Linden for the Power of the Patient Project. My guest today is Kristen Walter. Kristen is a clinical research psychologist at the Naval Health Research Center in San Diego, California, who investigates the treatment of post-traumatic stress disorder, PTSD, and conditions that commonly co-occur with PTSD, such as major depressive disorder, MDD, and traumatic brain injury. Dr. Walter explores both evidence-based treatments for PTSD and co-occurring conditions, as well as complementary and alternative approaches. She is an investigator on several Department of Defense funded trials, including randomized controlled trials comparing evidence-based psychotherapies for co-occurring PTSD, MDD, and another comparing two activity-based interventions, surf and hike therapy for MDD. She is also a privileged clinical provider in Naval Medical Center, San Diego, and a licensed psychologist in the states of California and Ohio. Welcome, Kristen.
Thank you.
First, can you explain the diagnosis of PTSD and what do patients experience who have PTSD?
Absolutely. So when we think about the first thing is that individuals have to be exposed to a traumatic event. And a lot of things can be considered trauma and traumatic to people. But when we think about PTSD, it's a little more specific. So in order to have a PTSD diagnosis, people have to be exposed to a traumatic event, and that consists of whether they are exposed to actual or threatened death, injury, or sexual violence, or they witness this occurring to somebody else. When individuals experience those events, it is very, very common to experience symptoms right after the event. Many individuals go on to recover naturally, while others go on to have symptoms more long-term. There are 4 different symptom clusters with PTSD. And so if a person is experiencing the first, which is re-experiencing, they may have thoughts about the trauma that pop in their head when they don't want them to. They may have flashbacks or feel as though they're reliving the trauma. They may have physical or psychological reactions to reminders of the event. And it's as though the trauma is happening again. A second symptom cluster is avoidance. So people might avoid people, places, or things that remind them of the trauma. They also may avoid thoughts or feelings about the trauma. The third symptom cluster is negative thoughts in mood and changes in those. And so individuals here may have persistent negative moods. They may feel shame, blame, negative emotions that come along with that. They may have difficulty experiencing positive emotions. They may have changes in how they see themselves, other people in the world, and they may have trouble remembering important parts of the traumatic event. And then the final symptom cluster is the arousal symptom cluster. And if people are having arousal symptoms, this could mean that they have difficulties with sleep or concentration. They may feel irritable or angry. They may have exaggerated startle response. They may feel as though they're on edge or on guard. And so it is when an individual experiences a traumatic event, they have these various symptoms in the clusters, and these symptoms last for at least a month and cause impairment in activities for the person, such as with daily tasks, with work, or getting along with others. And so that is, when we think about PTSD, that is what PTSD can look like.
Oh, that's really interesting. I didn't know that there was 4 different kind of categories like that. That's really fascinating. Kristen, what inspired you to become a clinical research psychologist and study PTSD?
Sure. In terms of studying PTSD, human beings have a remarkable ability to be fairly resilient, even in the face of trauma. And so that always interested me. And I wanted to be able to help the recovery process for those who were unable to recover in a natural process. And so that started my interest in trauma. PTSD is also a fairly new diagnosis, all things considered. And so, for many decades and centuries at this point, people may have experienced these symptoms and not have had a name for it, let alone any treatments for it. And so we do now have a diagnosis. We do now have evidence-based treatments. And so I wanted to be able to understand what treatments work for people, under what conditions, and how do we make those better? And so that kind of sparked my interest in trauma more generally. In terms of becoming a clinical research psychologist, I've been involved with with research and clinical work since my grad school days. And in our clinical internship year, which is the final year of the program, I was involved with not only providing treatment, but also doing treatment outcome research. So I was doing research that was looking at who benefits from treatment, how much benefit can people get. And my passion for both really grew during this time, because what I was seeing clinically was informing the research questions I was asking. And the answers to my research were informing what I did clinically. And so the two complement each other very well. And I've felt passionate about both. And so since that time, I've been doing both clinical and research work in my role as a clinical research psychologist.
That's very cool and very nice that you're helping out people that are suffering. You conducted a study on surf therapy and how it helps someone with major depressive disorder or PTSD. What were your findings with that?
Absolutely. So in addition to work we do on psychotherapy, we also look at what else can we offer to people. And our other work looks at activity-based interventions. And so in our first surf therapy study, we partnered with Naval Medical Center San Diego. They actually have a surf therapy program as part of the hospital. It can be an option for standard care there. And service members have the option of having surf therapy, which occurs for 6 weeks. It occurs once a week for about 3 to 4 hours. And in this study, we had 74 active duty service members who either had a physical or psychological reason for referral. And we looked at them before and after the program and found that service members had significant decreases in depression and anxiety symptoms, as well as PTSD symptoms for those who had a trauma exposure. They also significantly decreased negative mood while increasing positive mood. We found that because we didn't have a comparison group, which is helpful in research, we then looked at, okay, let's look before and after a surf therapy session to see if we can really look at the unique effects of surf therapy. And we found that even over the course of 3 to 4 hours, depression and anxiety significantly decreased, and the experience of positive moods significantly increased. Now, we saw this over the course of 4 hours, but the effects didn't last for an entire week. So it's almost as if a dose of the surf therapy needs to occur for people to have that benefit. But it was suggesting that individuals, especially as a complement to care, that surf therapy can be beneficial. We also looked at our data and looked at specifically individuals who had probable diagnoses of either PTSD or major depressive disorder. And we found very comparable findings, but they were actually stronger, meaning the benefits were greater for those who had either major depression or PTSD. In another study, we actually looked at individuals who had either depression or PTSD compared to those who have both, because we know in PTSD that depression is a co-occurring disorder about 50% of the time. So we compared those with a single disorder versus those with both, and we found similar effects, that those with both PTSD and depression actually showed greater gains. So our research indicates that surf therapy can be beneficial, especially as an adjunct to other care, for individuals with psychological disorders such as PTSD and depression, and particularly for those with both.
Oh, wow, really cool. You have to bring
Mhm.
something like that in the Midwest, some comparable type of care.
Well, it's funny because obviously I did all my training. I'm from the Midwest. And so to be doing surf therapy research is not exactly where I would find myself, but it's been a really fun path to pursue.
Very fun. What other treatment options are out there for PTSD, and are there any other new treatments that we could be looking forward to in the future?
There are a number of evidence-based treatments that we have for PTSD. So while I mentioned before, for a long time, we didn't have a diagnosis and no treatment for people, we do have treatment options now. So most of the treatment options are considered a cognitive behavioral therapy. And this is a psychotherapy that focuses largely on our thoughts and our behaviors. The first line treatments for PTSD are what we call trauma-focused psychotherapies. And those include treatments such as cognitive processing therapy, prolonged exposure, and eye movement desensitization and reprocessing. There are also non-trauma focused psychotherapy options that have good support, and those include present-centered therapy, stress inoculation training, and interpersonal therapy. So those are the three non-trauma focused treatment options. While there are no medications specifically designed to treat PTSD, there are several antidepressant medications that have been shown to be effective in reducing symptoms of PTSD. In terms of emergent treatments, there are several different mind-body options that have some supporting evidence. Those include acupuncture, mantra repetition, and yoga. However, there are other interventions that are currently underway, but we don't have enough evidence to support those right now. And as a field, when we think about treatment, it's important to consider whether interventions are standalone for people, where that's all they need, versus what treatments should be add-ons to, say, a psychotherapy or a medication treatment, and for who those benefit.
That sounds really good. Cool. It sounds like people have a lot of options, and it's really interesting. And your work sounds really amazing. Do you have anything else that you would like to add today?
No, the only thing I would mention is that if people are interested in additional PTSD specific information, the National Center of PTSD has an incredible wealth of resources available for people. And to just, if they have any questions, to make sure they talk to their provider to make sure that they get the care options that are best suited for their needs.
Well, thank you so much for joining us today, and we really appreciate your time, Kristen.
Thank you so much for having me.